ADHD Awareness Month, Reframing ADHD, Discovering New Perspectives.
So thank you. I think this is a very important question and not an easy one. So there's been and there is a controversy as to whether we should treat children and adults with ADHD with medication or with non-pharmacologic approaches. And of course, concerns around possible side effect of medication have pushed really the agenda towards considering more and more non-pharmacological approaches. However, what the evidence, or at least some studies say, and the synthesis of these studies say, is that if we want to target the so-called core ADHD symptoms, so inattention, hyperactivity, and impulsivity, medication, so the pharmacologic approach should be the preferred option. However, this does not mean that non-pharmacologic approaches are not helpful. Indeed, there is also evidence showing that non-pharmacologic approaches target other areas, other symptoms, and other problems beyond the so-called ADHD core symptoms. So, for instance, parent training behavioral approaches are very helpful. And this is supported also by evidence in improving oppositional behavior, conduct disorder, parenting. So I would say, to answer your question, I think that it's fair to say that pharmacologic and non-pharmacologic approaches should be both considered for the majority of individuals with ADHD. And they target different but complementary aspects. And so if we want really to look at the quality of life of the patient, we should consider both.
The mission of ADHD Awareness Month is to educate the public about ADHD by sharing reliable information based on scientific and peer-reviewed research. ADHD Awareness Month is brought to you by ACO, the ADHD Coaches Organization, ADA, the Attention Deficit Disorder Association, and by CHAD, Children and Adults with ADHD, in partnership with ADHD Europe.